Hey everybody, we are going to finish up law and ethics, and I'm going to give you guys a short review, things that you can expect to be on your test, okay? And then I want you to spend the rest of this time actually going through your notes, going through the slides, and making yourself a study guide. Once you complete that study guide, then I want you to take a picture of it, or allow your in-class instructor to see that you have created a study guide, and you'll actually get credit for that. So you can make it in the form of a Quizlet if you want to, or you can do a paper study guide, whatever you'd like to do, but that's what I expect you to do once we finish contracts. So we're going to pick up with contracts today, and give me just a minute to get there, and we will get started with contracts. So the reason why I talk about contracts is because a lot of things we do with patients are contract related. The way that we bill, the way that we take care of patients, even as little as setting up an appointment, that can be considered a contract with your facility or with your physician. Excuse me, guys. So you want to be sure that you understand what contracts are. You may need to go into a contract to open a bank account, to start to do your taxes. When you sign those, that's a legal contract. When you sign a contract with an employer, when you buy a home, when you buy a car, all those things are contract related. So it's important to know a little about contracts before you get started. If you're going to go to college and you're going to apply for student loans or financial aid, you have to sign contracts. So you want to be sure you know a little bit about them before you kind of get into that. So let's get started. It's not working the way I want to. So a contract is an agreement between two or more people, and it is enforced by law. Contracts are agreements between two or more people, and they are enforced by law. That can be a civil suit if you don't meet your end of an agreement. It could be a legal or a civil suit depending on how the contract is written. The elements of a contract: it's a proposal by one party to another party, and they are willingly go into this binding agreement. So an example of a contract would be when you go into the doctor's office. This is a good example of a time that as you guys graduate and become 18, that you'll be signing your own contract. So every year at the doctor's office, there's tons of paperwork you have to fill out. And one of those is your agreement to pay for services. It's called the Financial Responsibility Agreement. That once you sign that, that becomes a contract. And it basically says that you agree to pay for services. So if you don't know what the cost of those services are, you may want to ask for a list of what they charge or what they bill. Most places should be able to give you that. But when you sign that, you are signing a contract that says that, oh my goodness, guys, it's really warm in my room today, so I apologize. But it says that you can, that you're willing, that you agree to pay for the services. And on the contractor's end or on the facility's end, they agree to provide services based on specific requirements. So the agreement, I clicked the wrong one. So that would be what a contract could be. In healthcare, an individual enters into a relationship with a healthcare provider, and the provider agrees to take on that patient. When that happens, we agree to work to the best of our abilities to provide that care. You also have to be you have to accept it. So elements of a contract. So there's the acceptance. So there's the offer and the acceptance. That means you agree to that contract. And when you sign or you say yes, then you can be going into a verbal or a written contract. And the healthcare provider, an example of that is when we make an appointment. The provider gives you an appointment time. The provider agrees to be available within a normal expected window. If for some reason they're not available during that time, Oh my goodness, guys, I'm so sorry. If they don't agree during that time, then or something happens and they can't meet the expectation of being on time, then someone should be letting you know. Same thing with you. When you accept that appointment time, you agree to be there based on the instructions. So if they tell you to be there 15 minutes before and you arrive on time, they should be able to hopefully see you unless there's an emergency, they should be able to see you in a timely manner. The doctor agrees to examine you, but you have to say it's okay for them to perform the exam. No one can actually treat you or examine you without your agreement. So that's also you accepting the agreement for the doctor to take care of you. Elements of a genuine agreement. That's a valid offer that is met by a valid agreement. So an example of that may be if you're going to go to work somewhere. So here's an example of things that happen in healthcare or in the business world. Sometimes when you go to work somewhere, you actually have to sign a contract. But you can have a verbal contract with someone. If I was going to hire you, I would offer you a certain amount of money. I would explain to you what the benefits were. So I said I was going to offer you $10.75 an hour. That you're expected to work from 8 a.m. to 5:30 p.m. Monday through Friday, with the exception of holidays. I tell you what holidays that were closed. I would tell you that we provide medical, dental, and vision, and we pay a certain amount of it. Your cost of your benefit would be this, and we match up to 3% of retirement you choose to pay in after 1 year. So I've given you this offer of employment. Once you agree to that offer, then that becomes a binding and valid verbal agreement. Then there's lots of paperwork you have to go into, but that's actually a genuine agreement that makes it that's a valid offer. I've told you what we can offer you. If I were to offer those things to you and then we didn't meet those expectations, maybe we didn't really, I misrepresent maybe I misrepresent the insurance. Maybe we don't cover as much of your insurance as we said, or maybe I tell you you're going to work from 8 to 5:30, but then I change my mind and tell you I want you there from 7 to 7. That can make our agreement null and void. That can make it completely a void agreement because I've misrepresented what my expectations were. So, and if I told you I was going to pay you $10.75 an hour, and then I only paid you $8 an hour, that also could be fraud. Also, that could be considered as undue influence, which means undue influence is if I make you feel like you have to work those hours. So maybe I tell you your job is 8 to 5:30. But then I start telling you, I need you to come in at 7. I need you to stay till 8 o'clock at night. I need you to work for 3 doctors instead of 1. So those are things that I make you feel like you have to do. But really, that's not what you were hired for. So that could be undue influence for me, making you feel like for you to keep your job, you have to do things that maybe you shouldn't do. Or I tell you to change the coding on a chart for payment. And I'll tell you to put things in a chart that maybe aren't true. That would be fraud. So we have to make sure that when we go into a contract with someone, we understand that contract. And not only understand it, but we can hold people accountable for that contract. And if they can't be held accountable, then we get out of that contract situation. So the capacity, so we've talked about the offer, the agreement, and now we're going to talk about the capacity of the contract. The capacity of the contract is the legal ability to enter into a contract. So to legally be able to enter into a contract, I have to be old enough. For some contracts, I have to be 18. For some things, I have to be 21 years old. I have to not be under the influence of drugs or alcohol. That includes prescription drugs. That includes that I can't agree to a surgical procedure if I have been given pain medication. That makes that contract not legal, not binding. I can't agree to any kind of contract if my mental capacity is not intact. If I have dementia or Alzheimer's that's advanced, I can't agree to things. I can't go into a contract for things. If I don't have the mental capacity to understand the contract. So maybe I am 18, or maybe I'm 25 or 30, but I have a mental disorder. I may not be able to go into a contract because I may not understand what I'm doing. So you have to be able to you have to legally have the ability to go into a contract. That means you have to be old enough and not under the influence and have the mental capacity to do that. Legal disability. Legal disability is an individual who can no longer or cannot legally enter into a contract. So that would be that mentally impaired person. And mentally impaired doesn't mean there's special needs. It means that maybe at that time they have an active mental disorder, or maybe they're under the influence of some kind of medication. So that would be a legal disability, why they could not enter into a contract. Also, being a minor, being under the age of 18, unless you're married. If you're married and you're under the age of 18, you can go into binding contracts. But otherwise, you can't. So those are the same things we talked about: being mentally incompetent, being under the influence of drugs or alcohol, and also not having the ability to hold on, guys. I'm sorry. I'm gonna put you on pause for just a second. Okay, guys, I'm sorry about that. Let's get back to where we were. Back to contracts. Hopefully, they'll open up. All right. We'll have to scroll. I'm sorry. So once again, you cannot be semi-conscious, have a head injury. You can't be mentally impaired, mentally incompetent, under the influence of drugs or alcohol to go into a contract. Things to consider. The thing of value being exchanged is for something else of value. So if you're going into a contract where we're exchanging services, like I'm providing care, we're providing care, and you're paying for it, then that's something to consider, that you know the value, you know what it's going to cost. When payment is made by most of the time in doctor's offices and hospitals, that payment is expected upon services or shortly thereafter. So you need to read the financial portion. You need to take into consideration what the cost is. And it's okay to ask. It's okay to ask if doctor wants you to have something done. Say the doctor wants you to have an MRI done, then you need to know what it's going to cost. And that they need to know that they've contacted your insurance and you know what it's going to cost. Also, once you pay for a service, you want a receipt for that. You want them to give you something in writing that shows you paid for it, and what you paid for. You can always ask for an itemized statement, which will tell line by line what services were provided and what you're paying for, what your insurance portion is, what your portion is. You can always ask for those things because that's part of that contract, is knowing what services you're paying for. A person's entering into a contract cannot agree to do something that is illegal or forbidden by law. So contracts must be legal. I can't agree to sell you my kidney. I can't agree to sell you a part of my liver. I can donate it to you. I can give it to you, but I can't ask you to pay for it because that's not legal. It's not legal to go into a contract to sell a baby, but it's okay to adopt a baby. That contract is legal and binding. Those are just examples of things that you have to be sure that what you're doing is legal. I can't sell you a stolen piece of equipment or a stolen vehicle because it's not legal that I even have it. Types of contracts. So there's implied contracts, and those are nonverbal agreements of understanding. So an implied contract that's a nonverbal, just an agreement of understanding, would be that we have like a memorandum of understanding. It would be that we agree to provide services for each other. We agree to work together. That would be an implied contract. When you make an appointment, it's an implied contract that when we provide, I will be available for services, and once those services are done, it's implied that you'll pay for them. An express contract states the terms of the agreement, and in a distinct, clear language, it can either be written or oral. So we can go into an oral, we can go into a verbal contract. I can agree to sell you something for an X amount of dollars, and we can have that value. We can have that contract verbally. Also, it can be written. A written contract says that on paper that I agree to sell you a 2003 Chevy 1-ton pickup for $12,000. And you sign it saying that you agree to pay for it. That's a written contract. A verbal contract is where we actually just agree on a price and you pay me. So, but it has to be clear. It has to be clear what you're paying for, what you're purchasing, and what you're agreeing to. Whatever the contract you're agreeing to, you have to fully understand it. You have to read it. If you have to ask questions, just be sure you understand what you're signing. Oops, sorry guys. Healthcare contracts, the biggest one is informed consent. And I want to talk a little bit about informed consent and tell you what informed consent is. So we talked about HIPAA a little bit. We talked about informed consent. Informed consent is letting the patient, the healthcare worker, or the patient and the patient understand what the treatment, understand all of the positives and the negatives of a type of treatment. They also understand the cost. They understand what would happen if they didn't have the procedure. So here's an example. Someone has a torn ACL. Their torn ACL, if they have surgery, they can use they're going to use part of the hamstring, not on everybody, but, or they're going to use a cadaver hamstring. That's someone who has died and donated their body. They're going to use the hamstring from a cadaver, and they're going to rebuild that ACL for the patient. The patient needs to understand what a cadaver ACL is and understand that you can use the hamstring as well if they're developed enough, a portion of it, to repair the ACL. They need to understand that during surgery, they're going to have to be under anesthesia. They potentially could lose blood. They potentially could get a postoperative infection, that they could have damage to their knee. There could be other issues, or there could be a blood vessel nicked during surgery. They may need blood. They need to understand that after surgery, they're going to be, when they wake up, they're going to be on a machine that's going to continuously move their knee for a certain period of time. They need to understand that they're going to have anesthesia, and that they're going to have someone drive them home, that they're going to be given pain medication to treat their pain. So they have to understand all of those things that can happen. They also have to understand that ACL repair is not a life or death situation, that you can choose to wear a brace with physical activity for the rest of your life. So that doesn't mean you have to wear it every day. It just means if you're going to participate in sports or anything that's going to cause you to have some need strenuous agility to the knee, where it's going to be moving back and forth or side to side, in a side-to-side movement, that you would need to wear a brace. That it is possible not to have surgery. You could opt out of surgery. So that would be informed consent, that you understand all of the possibilities, the positive things that could come out of it, the negative things that come out of it. You understand the cost. You understand what's going to happen before and after surgery. You understand the surgical procedure. And then you make an informed decision on whether or not you want to have the surgery. And you give consent. You sign a piece of paper that says you consent to that surgery. So the patient or the healthcare worker or the healthcare power of attorney. Now, a power of attorney can be either medical power of attorney, or they can have durable power of attorney. Let me explain the difference in those. Medical power of attorney means if I'm not in a sound mind, or I'm in a position where I can't make medical decisions for myself, I have designated someone to make medical decisions for me. That's medical power of attorney. Durable power of attorney means that person makes decisions for me, not only medically, but they can make decisions for my estate. Like they can make decisions related to my finances, to my home, to my assets, all of those kind of things. They can make those decisions for me. And either the patient or their power of attorney gives written permission for treatment. Once they understand they have a clear understanding of what's going to happen, of the outcomes and the complications. Knowing like if you get the ACL repaired, they could need to give you blood. You could have an infection. That they're going to put metal in your knee. You have to understand that. So informed consent is it's an actual healthcare contract. And for anything we do to a patient, whether it's even just giving them a shot, we have to give them informed consent. When you go get immunizations, they give you information on that immunization that tells you all of the things that can happen while they're given the immunization to prevent you from having some kind of disease, communicable disease. But then they tell you the side effects and what could happen. When you go to the pharmacy and you get a medication, you get a little piece of paper that tells you what the medication is, what it's for, what the side effects are, what if you have an allergic reaction, what to do. That's also informed consent. It's giving you information on what could happen if you take that medication. So informed consent is a huge part, one of the biggest contract parts that we do in healthcare. All right, guys, that covers contracts. That's going to complete law and ethics and professionalism. Now, I want to take a minute to go back and let me get out of this screen. And I want to tell you some things that you will want to know for your test that's coming up, things to review. Okay, so for professionalism, you want to know the characteristics of a healthcare professional, the personal characteristics of a healthcare professional. What are those? You want to know what is considered professional behavior, what is unprofessional behavior. You want to be able to pick out pieces of, if an example, I may give you a scenario that says, Miss Johnson is going in to see Dr. Smith today. Upon entering the doctor's office, she is greeted by a front office staff who smiles warmly and greets her and checks her in. The greeter or the nurse comes to the window to call the patient back. She calls her loudly by her first and last name, and as they're walking down the hall, she starts discussing what's wrong with the patient. Which person was being unprofessional? The nurse, the front office person, the nurse and the front office person, or none of the above? That might be a way I would write a question. But that question, the scenario may cover 2 or 3 different things. It may be a little longer, and then it may have 2 or 3 questions related to that. So that's kind of how your test will be set up. There'll be multiple choice for the most part. You'll have a bonus question that actually you have to write in. You'll have to type in the answer or write in the answer depending on how you're getting your test. So for professionalism, you need to understand what is professional behavior. What's professional communication? How should you answer a phone? What would be professional in writing? If you're doing written communication, would it be professional to write in complete sentences, or could you just use text the way you would text someone? You need to understand what professional behavior is expected for healthcare professionals in regards to patient encounters. So look over those professional slides. I'm not going to ask you, y'all are not at a place where I would ask you to give me definitions. That's not letting me know what you know. You're going to get scenario-based questions. Same thing over law and ethics. I will give you a scenario that similar to the case study that some of you did, that will give you kind of this happened, which part of this were they not doing? When we talked about the different parts of ethics, when we talked about, medical ethics. So go through those slides and be sure that you understand what what it means to give just care, what it means to do for non-maleficence and beneficence. Be sure you know what those words are, but not just what the definition is, but what it would mean, what it would look like. Non-maleficence, what does that look like in the healthcare setting? What kind of contract would, if I put a scenario about informed consent, and I said a doctor asks a patient to sign for surgery, and it just gives them a few things, like it tells them that they're going to have surgery on their left knee, that they'll be in the hospital for 2 days, and then they'll go home on pain medicine. Is that informed consent? True or false? I may ask you something like that. So these questions, they will not be definition type questions. I will send your in-class proctor, your in-class teacher, I will send them multiple versions of the test so they can choose how to distribute those, whether they give one version to each class or they give one version to like maybe give one version to 3 students and one version to the other 2 students, however they choose to do that. The other thing I want to tell you guys, and this is very important, I want you to go back and pull your slides up, and you have 2 options to do this because you're going to get a grade for it. I want you to either make a Quizlet, and if you make a Quizlet, you can attach the link to this particular assignment. And as you're turning it in, you would turn it in and attach the link if you make a Quizlet. Or you can make yourself a written study guide to help you study. Go back through the slides, go back through the lectures, and make yourself a paper. You can make a paper study guide. Either way, you get a grade for this. So I expect you to either make the Quizlet and attach it, and it needs to be a Quizlet that would have your school email attached to it. So that I know that you made it, or your first and last name so that we know that you made it. With that Quizlet, be sure that it either is set up with your school email address or it's set up with your first and last name. Make that Quizlet or do your paper study guide. Trust me, I'm doing this not because, go back through your notes. Hopefully you've taken notes. Go back through your notes, make a Quizlet. Go back through the study, go back through the slides. Make a paper study guide. But work on that today, because today you will have your test Tuesday of next week. We're going to move on to leadership and a few other things that are more fun. But we'll move on, but we're going to complete this unit today. And so that's your assignment for the rest of this class period, is to make that Quizlet or make that paper study guide and turn that in, or let your teacher see it. Let your in-class proctor see it. Let her see your paper study guide and what you've done, because you're going to get a grade for it, okay? All right, if you have questions, please email me, and I'll see you guys soon. Thank you.